Hello, everybody, and welcome to another episode of Kaizen Spotlight. These are conversations with Kaizen champions, and it's my absolute pleasure to host Azuka Okeke, all the way dialing in from Nigeria, Lagos. Azuka San, as we like to call her, is the regional director of the Africa Resource Center, ARC, which is doing some phenomenal work in trying to build a bridge between the health ministry, the health system in Africa, especially in Nigeria and in the region, and connecting it with various private and other support systems so that the health services are able to reform, are able to build upon and become better. She's a great believer in bringing various stakeholders together, and she does some magical work in that area. She's able to convince people, bring all the like sort of put the jigsaw puzzle together. I've had a lot of personal experiences with Azuka and how she's able to connect all the dots and really create impact. She has been in this domain for a long time. She brings a lot of experience working with not only the in this sector, in this domain of development work, supporting supply chain and the supply chain network and various partners. She is been the one of the key pillars of the Africa Resource Center for Nigeria. And as background, she has done several courses in this domain, including, I was just reading her bio, some interesting courses even from MIT and Cornell. So thank you very much, Azuka-san. Thank you for sharing your time. And my first question to you in this Kaizen Spotlight conversation this afternoon is what strikes you about Kaizen? What really catches your attention? Thank you.
Thank you so much, Jayan-san. It's a real pleasure to be here and to be talking on behalf of Nigeria. What strikes me about Kaizen? I remember attending the first Kaizen workshop, and where you, Giant, you were presenting, and it fits into what we were thinking of in Nigeria with regards to using limited resources to make impact. And Nigeria, like so many African countries, have been supported by so many development partners, and more and more, everyone is talking about sustainability, government ownership. But it was more like talk, or very abstract. How do you move from the talk of sustainability and ownership to real tangible steps to make that happen? And so when I attended that workshop, it really was very clear how we need to go down to the Gemba, find out what really is the issue at the very heart of where patients or clients are receiving care. Without going down to that level, you may never understand the way to make the best decisions about financing health. And also, it also became apparent to me that we cannot, just like everybody was saying, we have to explain sustainability and ownership to government in a very practical way. And Kaizen made it very practical. When they explain lean, being using the lean resources that you have, or being lean in your approach, and that most times it's not really about financing or adding investment, but more about attending to waste, reducing the waste in the system, is a very good way of starting the process of improvement. So it was a very practical way of explaining it to my government to say, well, it's not always about adding more money, because in Africa we have to manage the resources we have to the issues of most need. It's even about starting from reducing the waste in the system, and if we can reduce the waste, then we can then know how to use our limited resources in the most appropriate way and practical in our approach to address health. So it was really a useful, I would say, the mechanism or the approach of Kaizen fits into the reality of what we are talking about in Africa. Thank you.
Thank you so much. When you work with multiple stakeholders, I have noticed that especially when you talk of trying to convince people to make improvements without investment, there is some kind of a doubt in people's mind because, as you mentioned, the normal approach to improvement is let us add, let us buy more space, more warehouses, or buy some new software, or computerized, digitized. While that is important, what has been your ongoing efforts in trying to convince the stakeholders that while we are looking at technology and additions, etc., what has been your experience and your approach to convincing people that we should also look at optimization, and what are the challenges that you've been facing in that direction? Thank you.
Thank you very much for that. And I think the most important thing in addressing needs is understanding the role that every stakeholder is going to play. You find that most of the wastages are mostly because we have different resources, but we are not looking at it in an integrated manner. And then you can find that in this space, different partners are supporting the same stakeholder in terms of government, and everybody is looking at the last, the issue, but looking in an isolated way. And you find that when we approach it like that, it brings in the wastages. So again, making waste the key information, or the one of the first steps, reducing waste in terms of government. Don't first of all think of what technology to use, or what system to change, or what distribution network to put in place. First of all, let's review how we address issues, who is addressing it, and how do we approach it in an integrated manner. Once, when, and you have also been privy to this, Jared, in Lagos, in Nigeria, for instance, one of the things we had to do as Africa Resource Center was for us to convince the partners to stop thinking about their solution and how they can support Lagos, but to start thinking about what is the problem all of us are trying to address. What is that problem? Is it about availability of health commodities at the health facility level? And then to look at it from the angle of what is every stakeholder bringing on the table? What will the Lagos state government bring? What will each partner bring? And putting it together so that nobody talks about the partners, we all talk about the problem and approach it in an integrated manner. That has actually reduced the waste, that has made the work more efficient. And then the good thing about it is that it also gives government an opportunity to know what their role is. So we all work together. So once we present it in that manner, it actually breaks that barrier. And everybody starts talking about, we're trying to solve this problem. This is my role in it. And we all appreciate when there is a change that we can all take in as part of our successes. The government particularly appreciates that, because really you can imagine, Giant, when you are different partners coming with one problem or one solution, it's really that lack of integration actually adds to the confusion. So again, is we are all trying to strengthen the system. It's what we have to acknowledge. Not just those of us that are accessing a particular grant, but so many people in the ecosystem. But if we don't come together to approach it as one in an integrated approach, we will add to the problem rather than solving the problem.
So true, and I have to really acknowledge the great length ARC, yourself and your team go to bring all the partners together on a kind of a common page. I think that's so important, and that is your toughest challenge, to get everybody to focus on one thing, and then people are not doing their own stuff. So that's very important. I know the ARC hub is something that is very dear to your heart, and the ARC hub is something that has been evolving very well, and I think personally has a lot of potential in not only in Nigeria but in the region. Why don't you share something about the ARC hub? The hub is something that you can explain best.
Okay, so one of the things we have done, and you're very correct, Jayant, it's the key challenge is trying to bring everyone to the table, because everyone, typical of this work in the development sector is we all want to address everything and not sometimes something, and sometimes we feel our own solution is actually the key, the icing on the cake. And most times we don't want anybody's intervention to disrupt our work, because we're also time limited, time bound. But one of the things that ARC has done in Nigeria is to create platforms. One thing, talking about sustainability and ownership, if you don't give government a practical system, a platform approach, and you only focus on a solution approach, solve this and go, you see, it doesn't give them that continuity. So one of the things we have created in ARC is platforms that solution after solution and after solution, government pathway to improving. We must acknowledge that many partners have been in this business of trying to strengthen our systems, and all we're doing now is to provide solutions as complements. So one of the things that we have learned is it's not about our solution, it's not about your solution, it's not about that solution. It's about government understanding the solutions that are available to them and then leading the solutioning, because these are people that work in the system, they understand the complexities, and they know how best to put solutions together. So the platform that we have created, which is the ARC Hub, is a platform that enables government access the different solutions and put it together in a projectized manner. And one of the things we advise them to do is to say, take it milestone by milestone. Don't try to solve the problems in the world. These problems have been existing. But if you can start it as a journey, typical to the Kaizen approach, continuous improvement. Start it small, bit by bit. Start it as a journey. Maybe start off with a project that takes you 3 months. Let's see what you can achieve with the resources that are there. Put it together like puzzles. So that platform is like, I sometimes the ARC Hub is like a playground for them, because they begin to say, well, I want to develop this, I need this resource. We bring this, maybe this solution or this organization to them. They put it at this stage. We need to do this. They bring another organization, put it at this stage. And they begin to work typical like private sector in a business model approach. And by the time they solve it in 3 months, we showcase them in the hub. They are encouraged. Then they say, let's take on the next 6 months, that same problem, using the different resources in the ecosystem to put together a solution and then move to the next level. It's actually one of, I think we love it. People think the ARC Hub is a training institution, but we say, no, it's not training. It's just a platform that helps government make sense of all the resources to reduce waste. So now you find that sometimes a partner comes in and they say, well, no, we're already accessing this solution. Do you have something else? Because we can't add too many things in what we're doing. So when we achieve the first 3 months, then maybe in the next 6 months, that is the journey to sustainability. And that's what we do in the hub.
Hub has been really, I've been looking at Hub, and it's got huge potential to become the real piece, which ties everything together. And it's digital, it's very useful, it's on the cloud, and it can only get stronger. Thank you for really putting this hub together. So this particular conversation, we have a 10 minutes format. As you understand, people don't have so much of patience to go sit through long conversations. So I'm going to ask you just probably one more question, maybe two questions. So I have been working with you, and we have been seeing how all these pieces are coming together. So what is your vision looking at the next 3 years, especially in Nigeria? All these efforts that we are putting together to bring all these stakeholders to help the common man finally get his get his medicines at the last mile, at the point of use at the Gemba. Uh, where do you think this is going? What's your vision? Where should all this come together in the next 3 years?
At the heart of our work is empowered teams.
Mm.
Like I said, it's not about the solutions, it's about who is going to make the decisions, the supply chain decisions. And we believe that the key person that owns the public health improvement journey is government. So what we have been doing is empowering states to take ownership, to take leadership, and to understand what it means to make supply chain decisions. And that also means how to invest in supply chains. So we have started this process in 3 states, which is Lagos, Kano, and Yobe. One of the brilliant things that we have seen is states are now writing us. We received a call from Ogun State to say, we want to have empowered teams. We are also hearing from Bill and Melinda Gates Foundation in Nigeria that receiving requests that their teams are to be empowered. The key thing in empowered teams is that the states make a commitment. It's very important that when we are trying to support government, that their commitment is in it, and not just commitment in terms of um, human resources, but also financial investment. When you have states that are going to invest in solutions, they will be committed to it. So we hope in the next 3 years that at least 10 states in Nigeria would have these empowered teams. We've seen, for instance, Lagos State, they are the ones doing their own advocacy. They are the ones because now they understand the supply chain decisions that need to be made. Nobody is telling them what to do. And they are not seeing it as partners, they are seeing it as we need to improve our system so that the citizens of Lagos State have access to the medicines they need. And they have become quite passionate. The more you empower people, the more they understand the need and they take it on. Now they are advocating to government to invest. They are advocating, they are writing to partners to co-develop solutions. They have a voice. If we have at least 10 states in Nigeria doing that, we believe that the impact we are all trying to sustain, not that there have been impact, there are impacts, but is to sustain the impact. We will begin to see it. So my hope, my vision is that 10 states to the 3 states we're working with will be committed to this empowered team so that they make the decisions that will really drive impact.
Thank you, ma'am. I really would like to continue this conversation, but this, as I said, we have a format, and I have to tell you that in the work that we are doing in about 10 African countries, we have noticed uh, that women, especially, are somehow better tuned to absorb the concept of kaizen. Probably because, as our chairman, Mr. Masaki Imai, always says, that women have a natural sort of, I don't know whether the right word is an instinct or ability to identify and cut waste. Because I think they have always played a role where they have to put all the resources together, especially in the African context, Indian context, Asian context, where resources are always challenged for a mother, for a housewife. So, what do you reflect on that? I think making women the Kaizen champions is going to be a very good, intelligent move, starting with you.
Yeah, I think, like I said, the first presentation, it clicked. It's all about reducing waste, the beginning part of investment. And every woman knows that, your household, the major part of your managing household is reducing waste. I don't, my children know I never like to see food wasted. Don't dare waste my food. I always say, do not waste that food because it would have, I would have made better use of it. So I think that's why so I can understand that as Kaizen champions, women can get it readily. I never thought of it like that, but now you put it so succinctly. Yes, I think you should focus on making women Kaizen champions. We get it. So
Yeah, you have a natural,
thank you.
instinct for it. So, thank you very much, Azuka San. I really appreciate your time, and We will be looking forward to more conversations with you. And thank you so much for joining us this afternoon.
Thank you so much, too. Looking forward to more conversations. Thank you.
Thank you.